Welcome to Mental Health Colorado's Hill Day webinar. We're glad that you can join us. Mental Health Colorado is the state's leading advocate for the prevention and treatment of mental health and substance use disorders. Today, roughly 500,000 Coloradans go without the mental health care they need. We're here to change that. We're going to begin by describing the top 3 priorities that form part of Mental Health Colorado's agenda. Let's start with prevention and early intervention. We know that in most lifetime cases of mental illness, the symptoms usually arise during adolescence. In half of all lifetime cases, the symptoms first appear by the age of 14, and in 3/4 of the cases, the symptoms appear by the age of 24. We also know that it matters where students are referred to treatment. Take a look, for example, at what happens to students who are referred to treatment for their mental health or substance use disorders outside of school. Only about 10 or 15% of those students end up getting the care they need. By contrast, when the same sort of services are delivered on-site at school, the chances that a student will receive the care she needs go from 10% to roughly 90%. A powerful argument for school-based mental health services. We're also going to talk a little bit today about coverage and delivery, a second area of priority for Mental Health Colorado. We know that the Capitol has passed a number of laws that govern the treatment of mental health and substance use disorders. One of our priorities is to make sure the state is enforcing those laws. Let's look at some examples. A few years ago, the federal government banned discrimination on the basis of pre-existing conditions, including mental health or substance use disorders. We need to make sure that Coloradans with pre-existing conditions continue to receive the coverage to which they're entitled. The law also makes mental health care an essential benefit insurance companies are required to provide. And the law says that insurers must maintain an adequate network of providers. What does adequate mean? Well, we're working with the Division of Insurance to put some teeth and clarity into that requirement. For example, we want to make sure that there is at least one mental health provider for every 1,000 policyholders. And we want to make sure that wait times don't exceed 7 days. And finally, we want to make sure that Coloradans don't have to travel too far to see a mental health provider, one who is willing to accept insurance and still taking new patients. Some of our research has found, and some of your own experience undoubtedly confirms, that a lot of the providers listed on insurance directories are no longer taking in patients. In fact, in at least one case in the country, one of the providers listed on an insurance directory was not only no longer taking in new patients, he was no longer taking in oxygen. He was dead. We're pretty sure that's not adequate. The law also says that mental health coverage has to be provided on par with physical coverage. In other words, insurance companies have to provide coverage for mental health or substance use disorders in a manner that is no less extensive than the coverage they provide for physical disorders. How well is that law working out? Well, that's one of the things we'd like to know. So Mental Health Colorado has launched a questionnaire. You'll find it on our website. We're asking you if you've tried to get care for a mental health or substance use disorder and whether you got the care you needed. We want to share the results with the Division of Insurance so that they can do a better job of enforcing the law and protecting Coloradans. That's their mission and ours. Finally, one of Mental Health Colorado's top priorities concerns facilities and services. We know that one of, if not the single largest provider of mental health and substance use disorder treatment, not just in Colorado, but around the country, is the criminal justice system, probably the most expensive and least therapeutic choice we could make. In Colorado, there are more than 5,000 prisoners with a serious mental health or substance use disorders. By contrast, Colorado has roughly only 1,000 hospital or psychiatric beds provided for Coloradans with severe mental illness. That ranks our state in the bottom quartile when it comes to psychiatric beds per capita. Again, Colorado is not alone in this regard. If you look across the country, you'll find that roughly 55% of the inmates in state prisons and 65% of those in local jails have some kind of mental health or substance use disorder, or both. We can do better, and we're working hard both at the Capitol and across the state to provide alternatives to incarceration. So prevention and early intervention, coverage and delivery, services and facilities, those form some of Mental Health Colorado's top priorities. I'm now going to introduce my colleague, Moe Keller, former state senator and state representative and chair of the all-powerful Joint Budget Committee, who is Mental Health Colorado's Vice President of Public Policy and Strategic Initiatives.
Thank you, Andrew, and welcome to our webinar. So in terms of prevention and early intervention, one of the most exciting bills to come along in a long time in the state legislature this year is Senate Bill 68. Currently, the state of Colorado has a matching grant program between the Department of Education and school districts on providing some services for students at the high school and junior high level to receive mental health counseling in the school. This bill would expand that service to cover youngsters in the elementary level. So Senate Bill 68 is one that we are going to be working hard on this year. We have a number of volunteers who will be speaking on behalf of that bill, and we're hopeful for its passage. The governor's budget has asked, the governor in his budget has asked for $9.7 million of the legislature to hire an additional 150 mental health professionals throughout the state in the schools. This particular amount of money is currently being considered by the Joint Budget Committee, which must approve it in order for the legislature to consider it for passage, and we do not know yet whether the Joint Budget Committee is going to approve that money. So another issue that is before us is accessibility to health care. In the Affordable Care Act that passed in 2010, there were a number of provisions that were very, very important for individuals who have mental illness and substance use disorders and their families. Essential health benefits, making mental health and substance use disorder a required benefit of every plan sold on the individual and small group market, whether they are in healthcare.gov exchange or not, had to offer something with mental health and substance use disorders. Our particular exchange here in Colorado has Connect for Health Colorado, it's called, has been one of the most successful exchanges in the country. We even have a feature that no other Connect for Health or exchange offers, and that is medications formulary accessibility, so that when a person goes on to the computer and wants to compare during their shopping experience of what the plans might offer, they can put in their medication, and only those plans that offer that medication in their formularies will come up, which is a great service for individuals who are using the Colorado Health Benefit Exchange. Unfortunately, we do have a bill, Senate Bill 3, which would repeal our exchange and would, as they said, the proponents say, would allow for individuals to bypass the exchange in Colorado and go to healthcare.gov, which is the federal government's exchange. Our 2 points in opposition to that is that, number one, the exchange, the healthcare.gov exchange, does not have all the provisions that our exchange does. Ours is far superior. But secondly, that Congress is discussing right now as we speak whether or not to eliminate the exchange altogether, which means there would then be no fallback for individuals to be able to shop on the computer and compare plans. Senate Bill 3 does not necessarily take into account that 200,000, just about 200,000 individuals in our state have purchased health insurance in the private sector through the Connect for Health exchange. And we're concerned about those folks not being able to transfer to healthcare.gov or not being able to navigate it the way that they can at the state level. So in terms of alternatives to incarceration, currently we have a number of situations where an individual who has a mental health crisis, either they are gravely disabled and don't understand how ill they are, or they are an imminent threat to themselves or others, for example, a suicide attempt or suicidal tendency. Currently, it is allowed in our state for the local sheriffs to pick up that person and put them in a jail cell for their safety. These are people who have not committed a crime, and yet in many areas of the rural parts of our state, they are placed in a jail cell. The sheriffs don't like it, individuals don't like it, but it's because we have not had therapeutic alternatives in many of our counties in the state. It is our mission to end the use of jails for mental health holds. We want to expand crisis services to rural areas of the state as an alternative to those mental health holds. So it's fine to say we won't hold an individual in jail, but we better have those alternatives in place at the rural area. So there will be legislation coming forward that will provide for, number one, ending the use of jails by January of 2018, and secondly, expanding and putting funding in to expand in a lot of local communities, smaller and local responses to individuals in that community who are having serious issues with mental health or substance use disorders. So there are other issues that are going on right now in the state Senate. This has been the most active legislative year that I can recall on criminal justice and mental illness within the criminal justice systems. We have a number of active bills. Senate Bill 12 is a bill that would allow for an individual who is being ordered by the court for a competency evaluation to, with the discretion of the judge, have that competency evaluation in the community setting rather than in jail. This would eliminate, number one, some people from being in jail, but number two, some individuals who are sitting in jail for months waiting for that competency evaluation to be able to access that in evaluation and service in the community. A second part of that bill is to have restoration, meaning now an individual has been found incompetent to proceed. We need to provide services for that individual to be restored to competency. And this provides for additional funding for individuals in community to be able to provide that service, not just in a jail, but in the community where it's appropriate. Senate Bill 19 makes it easier for Coloradans in either the criminal or the juvenile justice systems to receive consistent and effective medication. There has been discussion for many years about having a common formulary of medications that could be shared and available to law enforcement for jails and prisons, mental health centers, hospitals, the walk-in crisis centers, so that they all would have the same information about what medications are available and what medications an individual might be having when they show up in any one of these sectors. The common formulary will allow bulk purchasing, which would make it much cheaper, number one, but also that consistency of the same product that will be used across systems. So an individual who might be seen by a mental health center but shows up in a jail in another county, they would be able to access through HIPAA-compliant procedures all of the information of what the medication is and where to have that available for an individual. This is an exciting promise because we've thought about this for a very long time, and hopefully it's coming to fruition. I do want to mention that if an individual is on an antipsychotic medication that is not on the formulary, there is a process for the facility in question or the mental health center, if it's their client, to be able to fill out a form for having a medication appropriate for that person that is not on the formulary. Senate Bill 21 is another exciting effort in the state legislature this year, and that is to provide housing for reentry. Individuals in prison and or jails who are coming out into the community often have a great deal of difficulty finding housing. Housing, as we know, is pivotal to be able to have a person become stable in a community, reintegrate into that community, and be able to access services such as case management, peer supports, medication management, job assistance and job placement programs, and other therapeutic programs that can be in community. You just have to have housing first. And this particular bill, Senate Bill 21, has a $5 million cost to it, which makes it very difficult for it to pass the legislature this year. We do know that individuals who are able to go through the Housing First model are able to end homelessness more successfully and to be able to access community services more successfully. This is also a bill that we are here at Mental Health Colorado are working extensively and hard on to be able to provide. And so with that, I will close out the webinar. And I again want to thank you for joining us for this webinar today, and feel free to contact any of us here at Mental Health Colorado on our website or through our email to have any of your questions answered. Thank you.